So we are live, and hi everyone. I'm Tarun. I'm a co-founder here at Lissun. A very warm welcome to everyone who has joined us today for this discussion on mental health. Let's make it a reality for all. I would also like to thank and welcome all our panelists who have taken time out today on a Sunday to join us for this discussion. First, we have Dr. Jyoti Kapoor, who's a renowned psychiatrist with over 18 years of experience and the founder of Manasthali here in Gurgaon. Welcome, Dr. Kapoor. We also have Dr. Rakesh Durkhure, who is the director and senior consultant of bariatric, GI, and general surgery at W. Pratiksha and has more than 15 years of experience. We have Mr. Raj Nehru, who's the founding chancellor of the country's first skill development university, the Vishwakarma Skill Development University. And we also have Mr. Nishant Bhardwaj, who's a VP at Excite and also an avid sportsman, an Ironman coach, and a storyteller. Welcome, everyone, and thanks for taking time out. And let's start with my first question, and this is to Dr. Kapoor. Dr. Kapoor, if I was to ask you in very general terms, what is the current state of mental health coverage in our country? What do you think, from a very macro perspective, how are
Thanks, Tarun, and thanks for the opportunity to bring me here and talk about mental health because it is something that I think is something that is the need of the hour. Because mental health is something that people usually don't talk about, and even though in the last couple of years during the COVID times, etc., there has been a lot of focus on it. We just talk about it, but people who really need it are either unaware about most of the things that mental health is about or are not able to find the people who they can talk to. So if you answering your question as to what is the current mental health scenario, I think we know the statistics and we know that the number of psychiatrists overall in the country is, and a psychiatrist or a mental health professional to population ratio is not that great in our country. More than that, in the remote areas of the country, in the any city beyond the first tier cities in the country, the approachability and availability of mental health practitioners is not good. So if I ask somebody, I mean, people come and talk to us, and now thanks to telemedicine, we are able to, people are able to connect with us. So if I ask someone that, you need therapy, you should be able to go to a psychologist or a mental health professional locally because you need that kind of a support. Most of the time, people will come back and say that we don't know anybody, practicing mental health in our area or community. And it's not just an area in India. You talk about people in the northernmost part of the country. You talk about people in Himachal and Uttarakhand and Dehradun, and on the lower side of the country, southern part of the country, I get the same response. So from that I understand that the distribution of resources is not equal, not adequate, and therefore people who would want even to go to talk to a psychiatrist or a psychologist or a mental health practitioner may not have access to them. So that is, I guess, why we are here together, and it might be a great opportunity to address those needs, the unmet needs that we have for mental health in our country.
Thank you, Dr. Kapoor. And Mr. Raj, if I take the same perspective, you work with students, you work with a lot of organizations, and if you were to take that lens to this issue of, unequal coverage or lack of coverage, do you think it is limited to just access when you think of it from a student perspective, or is it also to do with awareness, stigma? What all challenges do you see when you look at it from your lens in terms of what is the blocker to extending this coverage? Mr. Raj, you're on mute.
So, thank you for asking me this question. I was listening to the previous speaker, the doctor, who has a huge experience, and I agree what she said. In my experience, in my understanding, what I have seen is that today the mental health is perceived with a sense of judgment in most of the cases, and there is a stigma, as you rightly said, associated with it. But there is another problem, that there is a state of denial when it comes to the mental health issues, and that denial is on account of lack of awareness. People, first of all, do not understand that they may be going through a mental disorder of some nature. And even if at some point of time someone detects it and communicates with them, they will continue to be in the state of denial, and denial is primarily because of the stigma that is attached to it. That's number one. Second, you see, India is a large country with a big demographic divide. You have cosmopolitan cities, you have then urban, you have semi-rural, then rural, then tribal. If you go across the country and take only, you just take the cities and urban cities out, you have 70 to 80% of population living in these areas. And unfortunately, even today, when I travel to the deeper rural belts, people do not have any clue of mental disorder as a problem. They do not consider. And if at some point of time they feel someone is having some kind of indications, they may go for some local jad fook and something, some kind of that kind of thing that happens in the rural. So the first biggest problem I feel is lack of awareness, lack of acceptance, stigma attached to it, and then accepting it as a problem. So to begin with, I think this is my opening remark for this question.
Thank you, Dr. Nehru. Dr. Rakesh, if I come to you, you obviously see a lot of surgery patients who might have either long-term complications or have been through trauma, or people who are in a stressful situation. In a situation like this, do you see the need for some of them to get help with mental health, and also, do you see what Dr. Nehru or Mr. Nehru just referred to as that lack of acceptance, that lack of awareness, that okay, I will get the physical help that I need, but mental health maybe not right now? So you're on mute.
Hello. Okay. Yes. Now, point is this, that we all have seen a movie of Amitabh Bachchan where he is written कि तेरा बाप चोर है. So if you call a person his a real problem, if you tell that person that his real problem, he will always be annoyed with you. So he's always angry. There is no acceptance of it. If you say ganja person a ganja, he will say no, I'm not. There is angriness. Okay. So no one accepts their problem. And on top of that, even if that person wants to accept it, the family never accepts it. So I've seen so many of the patients to whom I motivate them to seek a mental doctor, a doctor who can heal them, talk to them, bring out some kind of the problems in it, and try to help them out. But no, they won't go to him. So that is the biggest problem that I have seen. And into the chronically debilitated patient who had a trauma, who are bedridden, who will be bedridden also for a month, 1.5 months or 2 months. So even in that thing, the relatives, they do not understand that the patient, he is unable to speak, but yes, he is mentally traumatized. So we need to connect to those patients and also the patients who come to the OPD. They need to understand, yes, that this is also a kind of a illness that need to be cured and taken care.
No, thank you, Dr. Rakesh. And this is over the last 2-3 months at Lissun, we have also seen this. We'll come to these specific issues and what we can do to address them. But I want to go to Nishant. Nishant, taking the perspective of what you see in the corporate side as well as the sports side, right? Both the sides, there is obviously tremendous pressure, both from a work perspective. What has happened in Corona, all of us know that. And still, do you see even in the educated, so-called upper middle class, similar issues in terms of acceptance, awareness, and that will to seek help?
Thank you, Tarun. Thanks, Dr. Jyoti, Dr. Rakesh, my fellow panelist, Dr. Nehru. So amazing perspectives that have been brought out by my fellow panelists is that one is the availability of resources to be able to address this. And the second is acceptance that you have a problem. Now, what I feel being a sports athlete and a coach and a corporate leader is that while people who have access to these kind of services, there needs to be that kind of understanding that this is something that I need, this is something that I need to address. Now people are certainly getting exposed to so much social media and the so-called fitness influencers and the mental health influencers who are trying to create some source of I would say information, but my sense is that one should definitely not always listen to these kind of half-baked information, which is firstly available on social media. That is number one. Number two is that even if you do have access, it should only be taken as something which is as normal as probably any other problem that you might be facing. So what I tell my athletes as well as my teams is that accept whatever problem you have and then go out and address it. And the shortest and the perfect way to achieving and overcoming any problem is to go to the experts. When you go to a person who spent 15, 20, 30 years understanding, learning and solving that particular problem, you get to the solution to the root cause right away. So it's very important that the experts come out, have this kind of these platforms available to them, and they are able to reach because the right information in these kind of cases could actually be very critical between half-baked solutions versus getting to the root cause of the problem in the first place.
No, thanks, Nishant. Thanks. So Dr. Kapoor, we heard these perspectives. You spoke about access, others spoke about awareness and acceptance. The other perspective I wanted to bring, you see a lot of these patients, right? They come to you. So I think acceptance has happened, awareness has happened. But the question I had is, when you see these patients and if you have to look back, is there homogeneity in terms of the socio-economic or cultural background these patients come from? Or have you seen that variance increase over the last few years?
See, definitely, there are two factors in that can answer this question. The first factor being where you're sitting. So where I'm sitting, obviously, I will say a certain strata of population coming to me because Gurgaon being a city, expensive city, not everybody is reaching out. But from the experience and understanding of all my psychiatrists and mental health practitioner colleagues, now what I see is that there are a lot more people coming to us from all strata. So it's not like they're not. But at the same time, something like Dr. Rakesh mentioned, even if he's asking patients to come, and he's referred quite a number of patients to me, because psychosomatic problems are one of the most common problems in medical OPDs today. When we say psychosomatic, these are physical issues, but they have a root causation in your psychology, in your psyche. And those people are not willing to accept that their problem in the stomach could be related to their brain. And like Nishant just mentioned, which is a very, very, beautiful perspective that people should understand, that an expert who's been in this field for 15, 20 years, at least you should have some faith in them. But they won't. They'll just Google, they'll check stuff, and they'll say, ki, Acha, ye karna hai, ye nahi karna hai. You've decided. So many a times you have to, talk to these people and tell them. I have people coming to me, mera liver kharab rehta hai. And half the time I have to ask them, ki, Acha, aapka liver kahan hai? Yahi, kahi? So it's almost like you have taken a word and you're saying, mera liver kharab rehta hai. But doctor ne kaha ki, and this is one of your patients, Dr. Durkhure, कि doctor ने कहा कि नहीं आप एक बार psychiatrist को दिखा लो. So probably the liver is connected to the brain somewhere. So what I mean to say is that even the most educated and learned, literate people carry that prejudice. They carry that bias. One of which is that if I have read about it, I know it. Now you only get information from reading. You don't get knowledge. You don't get experience. You don't get understanding. It comes by experience. So there has to be some amount of faith. So you have to have faith in your doctor who's telling you, you go and see a mental health practitioner. You have to have some faith in your trainer or a coach who is telling you, that, you're not able to do this. So maybe something is, not right here. You're not relaxed. You're stressed out. So you're not able to, give that amount of productivity that you need. You need to listen to your teacher, your director of your college or your principal that, it's not just that, you are not reading adequately or your exams or scores don't matter. You're not feeling well. So maybe you need to go and see. So that kind of a trust or faith, I think we need to generate. And one of the major reasons why it is not there is that on a daily basis, we get so much negativity from across ourselves. Everybody, there's a cacophony of sounds, opinions. Psychiatry खराब है, mental health खराब है, marketing हो रही है, लोग पैसा कमाना चाह रहे हैं. So it's been put in our head so much that we just can't trust anybody. We are kind of doubting everybody's intention. So somewhere that needs to be worked on, and that is where I think when we are able to work on that, awareness as well as acceptance will come, because we need to come across to people and tell them, have some faith. The intention is correct. So I think that's the major problem here.
No, thank you, Dr. Kapoor, and that leads me to the question to Mr. Raj. So when you teachers or in the academic background, you talk to students about mental health, and you face what Dr. Kapoor just said is negativity or lack of real awareness. They've formed an opinion based on certain things that are going around. If we were to overcome that, what do you think we can achieve in terms of unleashing the potential of a lot of people in India who are probably held back because they are not seeking this kind of help?
See what Dr. Kapoor said. I have many friends who are doctors, and sometimes when I get the opportunity of sitting in their chamber while waiting for them to finish their work and so that we can go out, I have noticed most of the time when patients enter into the chamber of doctor, patients have already determined what problems they are facing, what is the diagnosis. They have already researched through internet so much that they don't leave anything to the doctor. They are now only waiting for a prescription from a doctor, which is acknowledgement of what they know about their disease. This is first problem. The internet has created so much of havoc. Today, doctor prescribes you a medicine. You go and Google and find out 50 side effects of that medicine, and then you have that medicine, but with this fear that this medicine is going to create another 5 more problems in me. And in next 10 days, you have believed that this medicine has actually created those 5 problems in you. That's a big issue that we are today grappling with. And this is with all the students, all the people, all the community people around us. And because of this, it has also created a problem that when people operate from this kind of a mindset, they also lose their willpower to handle it, because people around them do not have even the idea that they are going through these multiple disorders inside their head, which they are feeling now. And when there is no one to communicate about these things, what you are thinking inside your head, you start losing your confidence in you. You start losing that willpower with which you had to actually handle it. And then you keep on researching more and more at your own. And then you lack your discipline also to manage that. So I think this is one big issue which Dr. Saab also talked about, and we are also facing, because when students come to us, they have already made up their mind and they are now looking for stimulus to acknowledge, हाँ साहब ये problem है, and this is true. So if someone is not agreeing and acknowledging that, they say that that person doesn't understand me. So that's a problem that we face. And इसका सबसे बड़ा जो challenge है वो ये है कि जो हमारे आज टीचर्स हैं, फर्स्ट ऑफ ऑल टीचर्स आल्सो आर नॉट इक्विप्ड एंड स्किल्ड एंड ट्रेन्ड टू हैंडल दिस एंटायर इशू. वो अपना टीचिंग करने के लिए आते हैं इंस्टीट्यूशन में, लेकिन वहां जो ये मेंटल हेल्थ के इश्यूज खड़े हो जाते हैं, उनको तो इसकी बनत भी नहीं है, उन्हें तो इसकी अंडरस्टैंडिंग भी नहीं है. और बिकॉज दे डोंट हैव एनी अंडरस्टैंडिंग, सो देन टीचर गोज इनटू द जो टीचर पैराडाइम होता है. सो टीचर स्टार्ट्स टॉकिंग, टेलिंग यू, इंस्ट्रक्टिंग यू, डायरेक्टिंग you, which actually aggravates the problem more. So I think one big area to work is how we can equip our teachers. Every institution should have some kind of teachers identified as counselors, identified as mental health skill instructors who can actually handle such issues in the institution. And I think that is one thing that we need to do. Second, I think is we need to create an access for that. Many children do not have sometimes idea that there is an access where I can go and where I can take some kind of counseling or treatment, not only in the institutions but outside institutions as well. वो lack of access का भी एक बहुत बड़ा मुद्दा है हमारे देश के अंदर. अब अगर access कहीं पे होगा तो affordability का एक मुद्दा बन जाएगा कि क्या वो उसको afford कर सकता है. क्योंकि मैं अभी कुछ दिन पहले पढ़ रहा था कि भारत के अंदर लगभग 80% से भी ज्यादा जो मेंटल हेल्थ डिसऑर्डर्स से सफर कर रहे हैं, दे आर नॉट गेटिंग द ट्रीटमेंट. ईदर दैट इज द एक्सेस इशू और अवेयरनेस इशू और द अफोर्डेबिलिटी इशू. सो ये बहुत बड़ा एक विशियस साइकिल है जिसके अंदर हम लोग घिरे हुए हैं.
Thank you, Mr. Nehru. And Dr. Rakesh, this brings me to the question, right? If Google is playing such a role of a doctor when patients are coming to you with preformed opinions, not just about mental health to dur ki baat hai, even their physical health, they come to you probably with preformed opinions. And uske baad jab you talked about you refer patients, they don't understand. But if these patients were to take help, say something happens, some interventions, do you see an improvement in treatment outcomes? Do you see an improvement in their whole overall experience? What is it that we can pitch to them to say, ye ho sakta hai agar aap aisa karenge?
Okay. Yeah, that brings to the very practical question from your side, because I face it a number of times in my practice. Down the line, if you keep on asking about their disease, in third or fourth question, you can diagnose that yes, patient is not having a physical problem, he or she is probably having some kind of a psychiatric or a somatization problem. So, but first part of your question is this, that I diagnose the patient, I'll send it to someone else, but before the patient comes to me, that patient has been treated for his physical ailments by so many of my colleagues. So I always feel that our colleague doctors need to understand about this mental issues and the mental problem that is more important to diagnose and fish out these mental patients, psychiatric patients. So then only we can refer it to the exact person who can deal with them. So our colleagues, surgeon colleagues, physician, definitely they must, because they have read about this in their MS or MD something, but the surgeons, they are totally unaware about the problem. People still keep on saying about the acidity, they will do some kind of the operation for the acidity. People come with the obesity, they do the surgery for the obesity, but they forget to address to the issue of the psychiatric illness, which is underlying cause of all such kind of the problems. So that need to be chalked out first about your colleagues. Number two, when you try to send the patient to right doctor about the right illness, I always tell them that your hardware is all right. There is some kind of a complication with your software, and I'm not the software doctor. So I try to make them understand that your body definitely, first of all, you need to flow with the flow. You need to swim with the flow. That you have to accept what patient is saying. Patient is saying that I have got this disease. You have to first accept, yes, definitely you are having an acidity problem. Even I can feel that. Now then the patient will start listening to, yes, this is the doctor who can understand my problem. Then you have to tell them, okay, now your brain is getting wrong signals about this disease. Okay, so for those signal correction, you need to go to a signal master. And then afterwards, after 2 or 3 months, then I will take over the disease from her, him or her. So that's how I make them understand and push them to the right doctor. But I think that our colleague doctors need to be taught first about this problem. They are the one who need to be, the awareness within the society needs to come later, but first the awareness within the medical fraternity should come first.
No, thank you. Dr. Kapoor, I was going to come to you.
Yeah.
Do you see this happening? So Dr. Durkhure talked about it, but do you really see this happening from within the medical community, that, more doctors are taking this up, and being proactive about referring such patients?
In fact, that's the reason why I was raising my hand. That I'm glad Rakesh brought it up, because we've worked together, and almost a decade we worked together, and we used to often discuss about these issues that patients have, and they are not willing to come. So he would often say कि उनको क्या कहें कि वो आ जाएं, ऐसे तो आएंगे नहीं तुम्हारे पास. So we had this discussion that we have to be able to make them understand that their problems are real, but the causation is something that you are probably confusing with, and the causation is not necessarily where you are looking for. The causation can be somewhere else. So it's not like we're not treating you, but we are treating you with the understanding that whatever problem you have, that problem can be sorted better if you look at its source, the real source being somewhere in your, as Dr. Rakesh mentioned, in the software. The component that he mentioned about the medical fraternity, see, what we need to understand is that doctors also come from the same community. And if you were never taught to accept mental health issue as a mental health issue, then obviously you won't. You have a 15-day posting while you're doing your MBBS in the psychiatry ward. And as Dr. Rakesh would agree with me, many other people really don't go there or attend it. It's a single question in your MBBS final year exam. So you would think कि अच्छा ये 4 में से आता है, ये पढ़ लेंगे, चले जाएंगे. And many of the times, me as a psychiatrist have faced, my own colleagues telling me, doctor, ऐसी दवाई मत देना कि नींद आए, which would be like funny, because it's almost like telling me as if I don't know मेरी दवाइयों से क्या हो जाने वाला है. Like I don't know that, I can, what my medicine does. So that is a reality, but it's the same thing. It's occurring because the socio-cultural scenario has been such that nobody accepted mental health issues as real issues or as medical issues. It was always expected that the person has a control over their mind, that they can, if they decided, they could make themselves happy, less anxious, less afraid, less phobic, they could sleep. And almost everybody thinks that अगर आप टाइम से सो जाओगे, टाइम से उठ जाओगे, सही खा लोगे, तो आप ठीक हो जाओगे और कोई प्रॉब्लम होगी नहीं आपको. But the truth is that mental health related issues are as physical as any physical issue, because brain is part of your body, and that's where it is coming from. So answering your question from that perspective, and what Dr. Rakesh was saying is that your doctor might not actually tell you at times initially. And I have had patients coming after 12 years, 16 years of having faced a psychological issue and never been referred to a psychiatrist. But now, as we talk to the colleagues more and we have more understanding and we discuss these issues, I am lucky enough to be surrounded by people who are generally comfortable referring their patients. One of the reasons why doctors don't refer is also because then they're afraid that they'll lose their patient, because the patient will say कि ये हमें पागल के डॉक्टर के पास भेज रहा है, तो हमें इसके पास ही नहीं जाना. So most of my doctor colleagues will probably lose the patient because they ask the patient that they need to see me. So again, bridging that gap, developing that awareness and understanding requires a more subtle approach, and that subtle approach would be honest take that yes, our problems do arise from psychological issues and you need to address them. And just talking to a psychologist, psychiatrist, or a mental health professional is not going to make you crazy, or they're not going to label you. As I said initially, that most of us are surrounded by the doubt that whatever anybody is doing, their intention is to actually cheat you. Today the society believes that doctors are out there to cheat you. Their intention is not to treat you, they just want money. that is the major problem that needs to go down. I mean, our social media, our people in other fields need to start telling कि भैया यही नहीं सीख कर आते हैं यूनिवर्सिटी में सब लोग कि हमें बस पैसा कमाना है. Many of the people out there are trying to help you because the intention is, and the job is to help you, and it will bring money on its own. It's not like it won't. If I do good to a person, the person's going to tell 10 other people. So primarily this is the approach with most people. But unfortunately, we are biased, and that bias needs to be removed.
No, thank you, Dr. Kapoor. Nishant, coming to you, what we have seen on this in the sports side is, a lot of people who people consider successful, best in the world. Virat Kohli has come out. Sachin Tendulkar has come out with his stories. Simone Biles, best in the world, multiple time Olympic winner, has talked about her struggles. So this perspective that, if I'm being referred to a professional, there is something wrong with me, or something wrong with behind the intention. Why does it still hold ground when so many celebrities, people have now started talking about it? There is a lot of discussion post-COVID about the impact of mental health. But why is this still persuasive that, yes, what I have heard in my circles is, yes, hota hai, humko nahi hota.
Yeah. This is a great perspective, Tarun. Just segueing to the important side, which is, let's say, high performance individuals who are in sports, who are celebrities, or who are performing at the highest levels, or even CEOs or CXOs or VPs or of different organizations. What is the most important is that when you are a high performing individual, you know exactly what you need to do, and you've been doing it for years and years, and you're going out there and repeating it over and over again. But high performance individuals, especially people which you've just mentioned, Deepika Padukone or Virat Kohli or various other personalities who've come out and spoken about this issue of not being able to handle the pressure, or at some point in their life or in their careers have collapsed, is because first of all, this should be considered as one of the pillars of your overall success. To be a successful sports person, you need to understand that you will become successful if your mind, your body, your soul, your nutrition, your physiotherapy, your recovery, your socio-psychological factors, your sleep, your hydration, all of these factors have to come together, and that too on a daily basis. And most often than not, when these individuals go out and are on that particular tour where they are performing day in, day out, they're not giving their mind enough rest, they're not being able to recover mentally. That's when you have a breakdown. In a sport, let's say a triathlon, an Ironman, which I coach the high performance individuals, where your body is undergoing so much stress non-stop for 17 hours or even longer, or even just running a 42 kilometers marathon, it's all a mental game. And trust me, the same body, our bodies can actually go for hundreds of kilometers. I know individuals who can go for 350 kilometers without a sleep, without anything, the normal limits of the human mind. It all happens because of the mind. But the same mind, if it's not in the right state of being, can actually make you stop just after 5 kilometers and 10 kilometers. So it's all the mental game. And what happens is, when you do not allow yourself to explore that side of area, that area of your body and mind, and not allowing it to recover, not giving it good fuel, good thoughts, good motivations, beliefs, you do not have a circle around you which is feeding those kind of positive motivations and affirmations, that's when you have a collapse. And it's actually very nice that these individuals are coming out, because if millions, for example, Virat Kohli has around 200 million followers in different social media platforms. And so when this kind of individual who also endorses 45 other brands tells you that this is a problem, people do listen. So we do need these kind of individuals coming out. And trust me, I've seen when you are a high performance individual, you are more likely to collapse than a normal person who's just leading a normal life, normal subah utho, raat ko, the job and all of that. These high performance individuals are more likely to suffer these kind of episodes, so to say.
No, thank you. What I'll do is now start talking about what are some of the things that, individually or as part of our organizations we can do. Mr. Raj, my question to you is, what are the structural interventions that are needed to address this issue of, increasing coverage, more people seeking help? I know we spoke a little bit about affordability as well, so we'll take that as well. But are there structural interventions even before affordability that need to be in there on the awareness, acceptance side that either institutions like yourselves or individuals or other players in the ecosystem need to put in place? So you're on mute.
Yeah, this is a very good question. And my personal view is, as a country, India, we need to understand how this country used to handle individual. And if I look at the way our traditions were, the way our Gurukul system of education was, the way the cultural orientation had created the development of an individual, I feel four important factors that played a role in the holistic development of an individual, जिसमें आहार, आकार, विचार और व्यवहार, ये चार चीजों का जो मिश्रण होता था, the combination of all these four were meant for head, heart and emotion development in a very holistic manner. And दिस वॉज, अगर आप इसको स्ट्रक्चर फॉर्म में देखें तो भारत के अंदर इस पूरे स्ट्रक्चर को चार आश्रमों में डिवाइड किया गया था, जिसमें आपका ब्रह्मचर्य फर्स्ट 25 इयर्स होते थे, फिर 25 इयर्स के बाद another 25 years was grahast, and from grahast then you move to another 25 years to vanprastha, and then after those 25 years to 75 to 100 it was more about sannyas. अगर आप इस पूरे साइकिल को देखें, ये बहुत स्ट्रक्चरली भारत के अंदर डिफाइन किया गया था. और फर्स्ट 25 इयर्स ये जो, हालांकि ये बड़ा उल्टा सम लोगों को लगता है, पीपल फील इट इज ऑपोजिट कि फर्स्ट यू गो फॉर ब्रह्मचर्य एंड देन यू गो फॉर गृहस्थ. उल्टा होना चाहिए, यू गो टू द गृहस्थ फर्स्ट एंड देन यू कम फॉर द ब्रह्मचर्य. बट इंडियन कॉन्टेक्स्ट वाज, the way this development was, the purpose was the child will first go and move through the process of brahmacharya, where he will learn his role in context to nature, where he will appreciate the purpose with which he has been brought onto this world. He will see his connect with all other human beings around him. He will see his connect with the nature. He will see his connect with the immediate people. He will see his role and responsibilities. He will be taught about anger. He will be taught about fear. He will be taught about courage. He will be taught about coordination, cooperation. All this was supposed to be practiced in first 25 years, and that practice would make him a little controlled human being, and before he enters into the grahastha life, he has all those skills with him, and then he performs the duties of a. But anyway, we have not been able to maintain that structure. अब देखिए, पिछले 50 सालों में we have had a huge revolution in the country in last 20 years compared to before those 20 years, the digital revolution. When children were born, they were completely dependent on the parents, then they were completely dependent on the knowledge of the teacher. They had learned that the respect means you have to listen and acknowledge and accept what your parents are saying, what your teacher is saying, and that is the ultimate. In last 20 years, there has been a revolution of information. I spoke to my daughter a couple of months back, and I was asking her, and we went into a discussion, and the discussion went to a debate, and debate went into an argument. I said, hello, you are not listening to me and you are disrespecting me. My daughter said, Dad, how is this disrespect? I have a point and I want to communicate that point, and if you don't listen, that is disrespect. I immediately stopped myself. I said to myself, those days are gone when I and my father had a dialogue, and if I had some point, I will convey, and if my father doesn't agree to it, the discussion is over. Today, that is not the situation. Today, when a student enters into the class, he has the half of the information with him, which the teacher is going to, throw on him. So the first thing is, I think we have to understand this shift in the new millennial. We have to understand their learning styles. We have to understand their new approaches to experience and learning. हमने अपने बच्चों को सक्सेस के पीछे इतना भगा दिया है कि that they feel unless and until they achieve something, and that too right from the 4-year 5-year of age, until and unless they achieve something, they surpass some other student, they are going to be failures. And we have not taught them how to appreciate and respect failure. And because of that, some students have created false egos. Some youngsters have created false egos. One, either that ego is pushing them to achieve something at the cost of anything, or two, even if they achieve something, they will find someone else in the queue standing in front of them, and that creates more frustration. They thought, किसी को तो पीछे कर दिया, but जैसे ही उससे आगे निकल गए, someone else is standing in front of them. That creates another frustration. Or there is a false ego जहां पे I am not capable of competing with someone else, but I will create a facade around me to make others believe that I have achieved something. अंदर से खाली हूं, और वो जो अंदर का खालीपन है वो और एंजाइटी और डिप्रेशन क्रिएट करता है. मुझे लगता है कि जो एजुकेशन सिस्टम ही है, जब तक स्ट्रक्चरल चेंजेस हमारे अब नई एजुकेशन नीति में न्यू एजुकेशन पॉलिसी हैज ब्रॉट अ न्यू शिफ्ट, दैट इज ECCE, एलिमेंट्री चाइल्ड केयर एजुकेशन. जहां हमारे भारत में 10+2+3 का मॉडल होता था, अब नए एजुकेशन पॉलिसी में 5+3+3+4 का मॉडल लाया गया है. दिस इज अ ब्यूटिफुल वे ऑफ गोइंग बैक टू दैट ओल्ड एंशिएंट एजुकेशन, वेयर द फर्स्ट 5 years are required to be focused on that formative stage of shaping the mental development. I think ये एजुकेशन का जो स्ट्रक्चरल रिफॉर्म है, ये एक बहुत बड़ा इंटरवेंशन है. उसके बाद टीचर एनेबलमेंट, उसके बाद जो इकोसिस्टम, उसको मुझे लगता है कि डॉक्टर्स का रोल सबसे लास्ट में है. सबसे पहला रोल है स्कूल का, पेरेंट्स का, सोसाइटी का, टीचर्स का. अगर यहाँ पे स्ट्रक्चरल इंटरवेंशंस जो लाए गए हैं, अगर वो सक्सेसफुली डिप्लॉय नहीं किए गए, मुझे लगता है डॉक्टर्स का रोल आने वाले दिनों में बहुत बढ़ता जाएगा. अगर हम देखें लिस्ट में, आज रामनाथ कोविंद जी ने भी शायद 2-3 साल पहले कहा था कि 14% ऑफ पॉपुलेशन इन कंट्री इज सफरिंग फ्रॉम मेंटल डिसऑर्डर्स. आई वाज लुकिंग एट द डेटा ऑफ द कंट्रीज जहां पे लोवेस्ट मेंटल डिसऑर्डर परसेंटेजेस हैं, एंड आई वाज सरप्राइज. दे आर दोज कंट्रीज जहां पे बहुत ज्यादा ग्रोथ नहीं है, लेकिन वहां हैप्पीनेस बहुत ज्यादा है. हमारे यहाँ ये जो ग्रोथ का जो कॉन्सेप्ट आया है, कंपटीशन का कॉन्सेप्ट आया है, कंपैरिजन का कॉन्सेप्ट आया है, इसने एंजाइटीज क्रिएट की हैं, जेलसीज क्रिएट की हैं, एंगर क्रिएट किया है. मुझे लगता है पेरेंट्स का बहुत बड़ा रोल है, टीचर्स का बहुत बड़ा रोल है. हमारे बच्चों का दोष नहीं है. हम कल बच्चे हम थे, कल हमारे बच्चे आएंगे, परसों उनके बच्चे आएंगे. कहीं ना कहीं पे इस साइकिल को हमें एड्रेस करने की जरूरत है.
Thank you.
And hence, I would like to add here, it's very important that you should take up initiatives which push yourself and your own limits rather than, competing with others. One such initiative is one should definitely train to do a marathon in life. You will come to know that you yourself have so many, limitations, so many areas that you need to conquer, that you'll forget about competing with your other people. So it's very important that one should take up some kind of exercise regimen which helps you to compete with yourself on a daily basis. That's not a solution. That's not a solution for any kind of mental health issue that you may have, but it's always a good starting point. Just coming to the point that you mentioned, going back to our ancient roots, that if you wake up on time, get into a regimen, get into a discipline, kind of a disciplined life, I think a lot of your troublemakers, the issues of comparison and jealousy and all of these things will get addressed over a period of time.
Yeah, I think what you said, see, when we talk about this, you see, our human body has got many energy centers. Mental energy center है, emotional energy center है, physical energy center है. ये सारे emotional energy centers कुछ डिमांड करते हैं हमसे। फिजिकल एनर्जी सेंटर डिमांड करती है कि हम अच्छा खाएं और हम उस एनर्जी को कंज्यूम भी करें। मेंटल एनर्जी एक्सपेक्ट करती है कि हम कुछ अच्छा लें और उसके ऊपर अच्छा चिंतन करें। जो इमोशनल एनर्जी है उसमें एंगर, फियर, बाकी सारे एनर्जीज जो हमें ड्राइव करती हैं। अब हो क्या रहा है कि जिस प्रकार की सोसाइटी हमारे सामने खड़ी हो रही है, उस प्रकार की सोसाइटी में आज की डेट में फिजिकल एनर्जी अनयूटिलाइज्ड सी होती जा रही है। तो हम बहुत ज्यादा आईटी के ऊपर, बहुत ज्यादा डिजिटल वर्ल्ड में, हम बहुत ज्यादा लाइब्रेरी को भी डिजिटल वर्ल्ड में, स्कूल को भी डिजिटल वर्ल्ड में, तो फिजिकल एनर्जी अनयूटिलाइज, अनचैनलाइज्ड होती जा रही है, जिसके कारण से बॉडी के अंदर की जो डिमांड्स हैं वो पूरी नहीं हो पाती। और जब वो पूरी नहीं हो पाती हैं, वो किसी न किसी रूप में, किसी न किसी टाइप में बॉडी में डिफॉर्मिटी, डिसफंक्शन को क्रिएट करती है। सो मेंटल एनर्जी में भी यही प्रॉब्लम है। जिस प्रकार के थॉट प्रोसेसेस के थ्रू हमें जाना चाहिए था, बैलेंस, हम वो जा नहीं पा रहे हैं। जैसे मैंने कहा कि कंपटीशन के कारण से जेलसी इतनी सारी क्रिएट हो गई है माइंड के अंदर कि सारा अटेंशन वहां की ओर जा रहा है, जबकि इसे कंस्ट्रक्टिव साइड में जाना चाहिए था। सो आई एम जस्ट सॉरी, आई जस्ट डोंट वांट टू ड्रैग इट, बट जस्ट वांटेड टू ऐड दिस वन पॉइंट.
Yeah, I completely endorse the ideas that have been given over here, and I'm again barging in because I completely endorse the ashram vyavastha. I have been into readings on ancient Vedic psychology and Vedic philosophy, and in fact, I was giving a webinar for retired individuals, and that's when it came up, and I said कि आजकल हम 4 की जगह 2 आश्रमों में रहते हैं। हम एक ब्रह्मचर्य आश्रम में रहते हैं और एक गृहस्थ आश्रम में रहते हैं। वो गृहस्थ आश्रम ही चलता चले जाता है along with responsibility. How many people have you seen actually give up today at 80 their responsibilities of the household and say that no, I'm now going to contribute to the social structure and share my experience and let the younger people take on from here. So that problem has created so much stress that brahmacharya ashram wale brahmacharya se nahi nikalna chahte. Brahmacharya not as in not having sex, but brahmacharya as in not taking up the responsibilities of a married life, right? So they don't want to get out of it, so people don't want to get married because the responsibilities are high, and as an individual you want to achieve so much because you have been stimulated so much, you have been given so many targets and goals. So you rightly said, Dr. Nehru, that our role should come at the end. मतलब हड्डी टूट जाने के बाद जोड़ने का काम आता है. But what you are telling is what we call as preventive mental health. And preventive mental health or mental wellness starts from the moment the child is born as to how to manage your emotions, your feelings. And it's important to be able to be tolerant. It's important to be able to accept that the people out there who are elders and are talking to you from experience are, talking some sense. It's not like कि क्योंकि मेरे को आज पूरा डिजिटल वर्ड समझ में आता है तो मुझे मेरे डैड से या मॉम से ज्यादा समझ में आता है, बिकॉज जिंदगी जीना एक अलग ही कहानी होती है और वो एक्सपीरियंस से ही आती है, वो इंफॉर्मेशन से नहीं आती है. सो आई एग्री कंप्लीटली विद डॉक्टर नेहरू and Nishant also mentioned a valid point that we have to start from the beginning. So we have to go back to our roots and start from the beginning. But like Dr. Nehru just mentioned, our children are going to just listen to us. They are going to emulate us. They are going to do what we do. And we are the ones who are fighting कि मेरी कार की पार्किंग क्यों ले ली तुमने, या उसने आके मेरा ये ले लिया. तो टॉलरेंस तो हमें में ही नहीं है. We are so individual oriented now that we are not willing to give anybody else space. मेरा बहुत ज्यादा हो चुका है. So if we are able to work on that, definitely mental health problems will be less. But there are mental health issues that are biological, that are stress induced, that are due to the environment, and they need to be categorized. And if I know correctly, and Dr. Nehru will second it, that a psychologist needs to be there on campus, both in schools and in colleges, and the psychologist should be able to be approached by children. I don't know how many of them approach them, but they generally need somebody in the school itself. Even in the education curriculum, there is a whole set of child psychology books. I know because my sister is also a teacher and she read through them. But just reading or informing ourselves is not enough. We need to put it into practice. So I think I just endorse all these views here.
Thank
Yeah,
you.
very true, very true. I think जितना mental blast, mental health care issues की जो blasting हमारे देश में हुई है, ये जो we definitely need experts at this juncture because you have crossed all those limits. So now you need people to handle that. But जो structural point आपने कहा कि structurally क्या करना चाहिए? Structurally we need to go back to the basics. आज अगर मेरे घर में मेरे बच्चे हैं, अगर आप देखेंगे कि उनके अंदर इतनी एनर्जी होती है, अगर उस एनर्जी को घर के अंदर चैनलाइज नहीं किया गया तो बच्चों में किसी ना किसी प्रकार की, अभी ये जैसे कोविड हुआ था, आई रिमेम्बर सम, कुछ बच्चों से जब मैं टाउन हॉल करता था बच्चों के साथ, तो एक दो बच्चों ने मेरे से पर्सनली बात की, उन्होंने एंड दे वर फीलिंग वेरी एंशियस और डिप्रेशन के सिम्टम्स मुझे उनमें दिखने लगे थे कि उनका कहना था कि सर अभी इन 2 सालों में हम कुछ नहीं कर पाए और कुछ लोग तो आगे निकल गए होंगे, मैंने कुछ करियर ऑब्जेक्टिव्स रखे थे, अब मैं क्या करूंगा, मेरे पेरेंट्स का बड़ा प्रेशर था मेरे ऊपर, मुझे ये करना था, मुझे वो करना था, और अपने आप ही अपनी स्टोरीज शरीर अपने मन के अंदर खड़ी की हुई। अब पेरेंट्स का आप देखिए, बच्चे पैदा होते हैं तो पैदा होते ही जो पेरेंट्स का एक ईगो होता है कि भाई बच्चा कुछ बने, तो बच्चों को बिफोर वो गोदी में ही होता है तो उसे हम ये स्टिमुलस देना शुरू कर देते हैं कि उसको देखो, ये देखो, पड़ोस में देखो, ये चीज अच्छी हो रही है, तुम्हें ऐसा बनना है, तुम्हें वो करना है, तुम्हें फला आदमी की तरह रहना है, तुम्हें राम बनना है, तुम्हें कृष्ण बनना है। तो ये जो बच्चा गोदी में होता है, इसकी इसकी डेवलपमेंट ऐसी होती है, कंपैरिजंस में डेवलप होना शुरू हो जाता है, और ये कंपैरिजंस में जब डेवलप होना शुरू हो जाता है, उसका अपना ईगो उसको ये कहता है कि भाई मैं तो कुछ भी नहीं हूं, मुझे तो जो दिखाया जा रहा है वो सब मेरे से बड़े हैं। और जब वो उस ईगो के साथ साथ ग्रो होता जाता है तो उसे लगता है कि ये जो मेरे आसपास के लोग हैं ये सबसे अच्छे हैं, मैं बिल्कुल कम अच्छा हूं, मुझे इनसे अच्छा बनना है, और वो नए नए तरीके खोजना शुरू कर देता है, जिसके कारण से वो अपने आप को स्ट्रेस में डालना शुरू कर। मुझे लगता है स्ट्रक्चरल चेंज में पेरेंटिंग जो सबसे बड़ा रोल है, जो हमारा ट्रेडिशनल कॉन्सेप्ट था, कैसे बच्चों को घर के अंदर डेवलप करना, किस तरह का स्टिमुलस उनको देना, उसके बाद स्कूल के अंदर, स्कूल की जो आज शैक्षिक व्यवस्था इतनी कॉम्पिटिटिव है, जो एक बच्चे को बच्चे के साथ जेलसी क्रिएट करवा देती है, बच्चे को बच्चे के साथ कॉम्पिटिशन क्रिएट करवा देता है, और जो बच्चा सबसे लास्ट में आता है उनको एक डिस्कार्डेड लॉट की तरह देखा जाता है। तो ये जो व्यवस्था है हमारे यहाँ पे, इस व्यवस्था को जब तक हम बदलेंगे नहीं, वी विल कंटिन्यू टू हैव द सेम प्रॉब्लम। एंड देन देयर आर फंडामेंटल्स, जैसे आज आप देखिए कि आपको खाना अच्छा मिलना चाहिए, यू नीड टू हैव दैट फूड दैट एनहांसेस मेंटल कैपेसिटी एंड स्टेबिलिटी। देयर आर सो मेनी फूड्स व्हिच आर एक्चुअली प्रिस्क्राइब्ड इन द इंडियन कल्चर कि जो अप्रोप्रिएट हैं हर स्टेज ऑफ लाइफ में खाने के लिए, लेकिन हम आज क्या खाना बनाते हैं, क्या खाना खाते हैं, किस खाने के पीछे हम लोग भागते हैं, दैट हैज आल्सो क्रिएटेड सो मच ऑफ हैवॉक इन आवर लाइफ। आप देखिए खाना खाने के बाद वन इंपॉर्टेंट थिंग इज, जिसको निधि ध्यासन बोलते हैं, यू हैव टू कीप योर कोलन क्लीन। Hundreds and thousands of youngsters and adults are today facing a problem of constipation, and let me tell you, it is one of the biggest problems of physical and mental stress, because people have forgotten how to keep their colon clean. And then connecting with the nature के साथ कैसे कनेक्ट करें, ये किसी को समझ में ही नहीं आता है आज की डेट में। मुझे लगता है कि ये व्यवस्थाएं अगर ठीक हो जाए, these things are worked upon, and I think we will have lesser load on the economy in the coming days, because these stresses and these problems are creating more load on our economy as well.
So इस पे डॉक्टर राकेश, एक ऑडियंस से भी क्वेश्चन है, एंड आई आल्सो वांटेड टू आस्क यू, वी स्पोक अबाउट कि डॉक्टर्स का रोल बाद में आता है, बट वो एग्जाम्पल कोट हुआ था कि हड्डी टूट गई तब डॉक्टर को आना चाहिए, बट व्हाट यू सेड वाज कि हड्डी टूट भी जाती है फिर भी जुड़वाना नहीं चाहते लोग। तो दो एस्पेक्ट्स हैं इसके, एक तो लोग नहीं जुड़वाना चाहते। द क्वेश्चन आई हैव फ्रॉम द ऑडियंस इज, डू यू सी ओपननेस अमंग डॉक्टर्स टू स्ट्रक्चरली इंटीग्रेट मेंटल हेल्थ in larger healthcare?
The answer is no. Okay, because I am the person who is totally out of this psychiatry field. Okay, so I am a doctor who sees the problem and then treat the problem. But what happens, the mental issue is the problem which no one sees. So our mind does not want to trust or believe onto the things which we don't see. That's what is the problem. Now about back to the question, doctors do not want to get integrated into this kind of a thing. There should be a sandwich therapy for this problem. That means the population or the patient who are suffering should get the care both from the bottom and from the top. Like if I ask you, okay, if you, so I don't know if you're a doctor or no doctor, but like you know everything about corona. All the population in this world, they know about corona, what a virus is, what a D-dimer test is, what a CRP is, what a CBC is. Why? Because of the acute problem everyone has got to know about, that these are the things, these are the parameter one should need to monitor. Everyone knows this thing. Now the dengue is in the market. Everyone know what the dengue antigen test is, what the platelet is, what is the normal count of the platelet. So there is an awareness about all kind of the physical diseases in the society, but there is no zero awareness about the mental problems in the society. Now that need to come directly from the top. You see the advertisement in the newspaper that everyone knows about the dengue, that 10 बज के 10 मिनट के लिए ये करो, and some chief minister of one state saying that you should need to address this thing because there is a problem. Now from the politician, from the top government official, there should be advertisement that these are the points you need to address to, and you need to check yourself, DIY kind of things, that yes, if I the answer is yes to any of these following 10 questions, then I have got some problem, and it is good to go and seek an advice from a professional. That awareness should come from the government. Another role of the apps like you guys are doing, spreading the awareness about this thing, that to-do list, clean up your body, clean up your mind, declutter the thing. If you can teach this thing to the society as to address to these points, and if they say yes, they should need to go to the professional to seek help from this thing. And also, why is this that the doctor do not want to help into these kind of the things? Because they think that their patient might go away, and secondly, because they have been treating the same patient for any physical problem, now they will have to point four fingers towards them. Hey, yaar, I have been doing wrong for all so many months treating this patient. Now, what will the patient be thinking that, yaar, doctor sahab, aap galat kar rahe the, actually, meri problem to ye thi. So, acceptance among the doctors themselves that yes, they were treating for the physical needs, but the patient was having a mental issues. So that's why the doctors are not able to understand. So our like the psychiatrist and the psychologist, psychotherapist, all need to spread the awareness among the doctors, health professionals, practitioners, to the management, to the insurance companies, that at least one visit is allowed. According to the law, one visit should be allowed by a mental care professional to all the patients who are admitted into the hospital, or who the general population thinks is a hila hua. So a one visit has to be should be given as a free of charge, or their payment should come from the either insurance company or from the management. Yeah, they need to understand the management. All the management need to get screened for their mental health issues. Yeah, then only they will understand, yes, this is actually is a problem.
No,
I
thank
think
you.
so.
Thank you. We are almost out of time. I have two audience questions that I'll share, and then we'll close. So the first one is for Dr. Kapoor, and this is from a mother. And the question is: we as mothers are really worried about our young children at such a young age. They have faced a pandemic. How will it impact them in the future? And as a parent, what can we do to bring positivity?
Okay, and I get that question often. And the first and foremost thing I tell to the mothers is that your child is going to emulate you. So if you're not anxious, your child is not going to be anxious. So the first thing that we need to do is reduce our anxiety and stress as parents if we want our children to be able to manage it well. Second is if we have a problem, say an emotional issue, and we try to hide it, we teach the children also to hide it. So if they come up to you saying that I'm feeling upset, don't tell them what's there to be upset about, what you should be upset about. You got everything in the house, nothing's going to happen to you. Instead, we have to be able to listen to them. And the listen word is coming so often, I'm glad. You should be happy that you brought this out. So we should be able to listen to that, what the children are saying. And the third important component is that, like Dr. Nehru mentioned and Nishant mentioned, and we all see it often, that while the current, modern technology has given us so much of convenience, it has taken away the most important part of being a human, that is to be creative, that you have to be active physically and mentally. When you're physically active, your energies are aligned and you're doing things which help you feel better. When you are mentally creative, the same thing. But when you are on online games, or you're on TV, or you are on mobiles all the time, there is no creativity happening. It's a passive process of overstimulation. It's like junk food, like Dr. Nehru mentioned. It makes you, gives you a massive dopamine rush when you eat something great or see something fantastic. But then real life doesn't sound so nice. So what we need to do as parents is to actually reduce the impact or the exposure children have to all the social media, the digital media. They need to come back to nature. They need to physically become active, communicate more, talk more, get one-to-one interaction with people around them, and hang out with their peer groups. If we read more, that's very important. So if we are able to do that, one, low anxiety among parents. Two, do not compare children and try to set benchmarks for them. Three, listen to them so that they are able to express their emotions. And four, avoid social media and digital media exposure as much as possible. If we do that, I'm sure children will be fine.
Thanks, Dr. Kapoor. My last question of the day, and this is for Nishant. Nishant, we spoke about responsibility of celebrities and the role they're playing. The question I have from the audience is, what roles can corporates play in this? Because they are again a big part of the whole ecosystem, the way the country moves. Corporates play a big part in this. And in the past, they have taken active social responsibilities in different segments. Is this something that corporates should? So Dr. Rakesh spoke about insurance companies, but can corporates today encourage people to take that physical health test every year, right? Is this something that corporates should also be playing a role in?
Sure, that's a very valid and wonderful question. I tell you what, even amongst corporates who are considered to be like the top 10, 20% of the country's, household income, the issue is that if a senior member of the corporate management goes out and starts getting the mental health sessions done, and then they start billing it to their company, it is somehow in the future seen as a limitation. It can be seen as, this person is probably not fit to lead the organization, and hence people try and keep it very private, which is okay, as long as you are able to address those issues, however private or publicly or through your own company's insurance, that's fine. So the thing that corporates should inculcate is that openness, that acceptance that mental health is like any other issue that you go and get yourself treated for. It could, so that stigmatization of this problem should be taken away, that if a leader has gone and taken some sessions with a psychiatrist, that should not be taken as like a hindrance in their career progression. That's number one. Number two, a lot of corporates are now coming together and bringing things like marathons and mental health vacations and mental health day in their culture. So that is something that should be promoted. In fact, I would go one step ahead. I've done that in my previous organization also. I was working with State Bank of India, and banking as a system is considered like a not so fit, not so healthy kind of an environment. So what we did there was we created a property called SBI Green Marathon, where we scaled it up to 15 cities across the country, and more than 1.5 lakh people participated in the two editions that we did. So, if organizations can come together and bring out these kind of initiatives which bring people together towards a common goal of mental health, physical health, emotional health, all put together, and create an environment which supports this, that is something that will take people forward. So people should actually be celebrated when people come, this happened during COVID, when people used to beat COVID and come back and join the workforce. They were appreciated. Oh, very well done, you've survived. Same should be the case with someone, people around you, that very nice, you've defeated this particular problem of your depression or whatever, so on and so forth, the issues that you had. Come back to the workforce. We really appreciate what you did and how you fought through. There should be an ecosystem where it is inclusive and accepted within us. And who are these corporates? We are the corporates, right? If I start accepting my teams, I have a team of, let's say, 20 people reporting into it, me. And if I'm allowing them that work, that time to decompress, that time to recover, and I accept them for their fight and come bring them back, probably those 20 people will go ahead and celebrate 200 other people who fought this out. So that's my 2 cents on this from the corporates.
Yes, Dr. Kapoor.
I know we are short of time, but I just can't. I'm so glad Nishant brought this up and this question was asked, because I have so many people coming to me from corporate background who are unwilling to submit a certificate that I have told them to rest for 2 weeks or take a vacation, because they will be treated as mentally incapable of performing their duty. And if I tell them that it's all right, you would take a break if you had typhoid, wouldn't you? So they are not willing to do that. Secondly, is the corporate culture, and I don't know how true it is. Maybe you know better, Nishant, and you know better, Tarun, because you are in this field. But the stress is scary. It's downright scary. These people are working for like 16, 17 hours. There is no boundary now with the work from home culture between your personal and professional life. And because of the financial issues, people are so afraid of losing their job. Then the kind of goals they tend to have, the exhaustion, again, is crazy. There is burnout, total burnout at times. So that's exactly, there's a large population in the corporate world out there. There's a large population in the student world, and then there is a large population who is productive corporate people whose concerns need to be addressed. And if we are more sensitive to it, and I tell this to my patients all the time, that, you are actually mentally healthy because you're seeking treatment. Out there are so many people who are not seeking treatment, doesn't mean they're all okay. So people who are seeking treatment are probably more sane than people who are not seeking treatment. So, like you said, that you need to be appreciated for the bravery of, stepping out of your comfort zone and coming to a psychiatrist or a psychologist and saying, boss, help karo, mujhse nahi ho raha hai. So if you can put it out loud in large letters, big words, hoardings, talks, workshops, webinars, I think there will be more acceptance, and will people like, Nishant out there who can, tell it's all right, boss, तुम्हें जाना है 2 हफ्ते जाओ, retreat पे जाओ, rest करके वापस आओ and be more productive. That person will actually be more productive. Would not be bearing the resentment कि मुझसे गधे काम करा रहे हो तुम और मेरा ख्याल नहीं रखते हो. So I think that's very, very important. So sorry, I've taken too much time, but I really, really like the fact that these things are being brought up today in this conversation.
No, I think that line that you said is something we should all take. You are actually sane if you are seeking help. It's a beautiful way to put it. You're not insane if you're taking help, but actually sane. And on that note, I would thank all of you for taking time out on this Sunday and sharing your perspectives on this topic. Hopefully our listeners found it very useful, and we would love to keep having these kind of interactions. We will obviously be in touch with all of you, and thank you, everyone.
Thank you so much for having us. Thank you.
Thank you.